Good evening, coding cadets. Um, I'm Dr. Charlotte, your board certified ophthalmologist and coding coach and strategist. I'm here to help doctors who are in their first 5 years of practice really master the billing and coding system to make sure that they get the money that they deserve for their hard work. And you may ask, welcome. I'm here in Abilene, Texas, and you may want to know, why did I start talking about billing and coding? And one reason why I decided to start about billing and coding was, I was a medical student. I went to my state medical school. I did very well. I was able to match in a top residency. I'm an ophthalmologist. Ophthalmology is a very competitive field. I was doing a fellowship at a private practice because hopefully, in addition to becoming an excellent surgeon, I would master some of the business aspects of medicine. So I finished my fellowship. I was excited. I started my new job. I bought a house, and everything came falling down. After 2 years, basically, I wasn't offered partnership because I wasn't making enough money to give the owners, you know, a, um, the owners the money to buy a share of the practice and to also support my salary. So as a result, I had to pack up, leave, sell, my stuff. And as a result, every time you change practices, then you have to start back at square one. And so that happened a second time. I thought the second time I would do it better. Was still making a bunch of billing and coding errors where I left several $100s on the table with each surgery, and then just really didn't understand the nuts and bolts of how to put the numbers together to be an expert billing encoder. So then I basically had to sit down with a CPT book. Myself also have invested in tons of seminars and lectures to master billing and coding. So tonight's topic is an RVU. So what exactly is an RVU? An RVU is a relative value unit. An RVU is a number that the government has put on medical work for a specific office visit, uh, procedure code, and then they link that to reimbursement. So, um, if you are seeing a patient and they're a new patient and you use the level 4 evaluation and management code office visit, that would be the 99204. And we discussed how you bill and code appropriately for the 99204. Hi, Dr. Rashana. We are talking about the RVU, or the relative value unit, and no matter which way you get paid in medicine, you need to know how to be paid in medicine. So the relative value unit is what the government has used to value a piece of work. It's set up by Medicare and CMS. And the first example is the most common visit, the new patient visit, the 99204 visit that doctors should hopefully are coding, or the 99205, the highest visit. So the relative value unit of the 99204 is 243. Say, for example, if a patient comes back and you're still billing them as a level 4, their visit is 99214. So basically, the government says that 3-unit value breaks up into parts. So one part is the doctor part, one part is the office part, and one part is the malpractice part. So you need to find out what part you are going to get when you bill and code for that. So Many physicians are employed. A lot of physicians are employed by the RVU model. So if a level 4 new patient code is only worth 3 RVUs, can you guess how much the level 2 RVU, the follow-up level 4 code is? That's only 2 RVUs. So the reason why I say that is because some people get contracts and say you have to make $10,000, 10,000 RVUs to keep your salary. But an RVU is just like a fake dollar. You need to learn math. So if you are a physician and they tell you you need to make 10,000 RVUs, you have to do some math. Divide that by how many days you work a day, how many patients you're supposed to see. So you know the currency of your paycheck. So for example, if you have to make 10,000 RVUs, you need to be seeing, if you're a family practice person, you need to be seeing 60 to 7 patients a day. So the RVU value doesn't change. So if you're a cancer doctor and you see a new patient and get 3 RVUs, if it's a really sick patient and you get 4 RVUs, you've spent maybe a half an hour with that patient getting that RVU. Well, if you spend an hour with a patient or half an hour with a patient, how many new patients can you really do in a day? So say you see 20 patients a day, that's a lot. If you're a cancer doctor, if you're a psych doctor, if you're a doctor spending a lot of time with your patients, four RVUs times 10 is 40, but then you have to calculate not every patient's a new patient. So then those return patients may only be 2 RVUs. So you see that you are putting dimes in the bucket where you really need dollars. So basically, an RVU is the unit that you're being paid for. So where does the RVUs really benefit a physician? It benefits the proceduralist. So I'm an ophthalmologist. So when I do an eye muscle surgery, each surgery I do is at least 8 RVUs. So I can do a strabismus surgery in half an hour. So if my team is working really fast, an hour and a half, I've made 20 RVUs. So I can maybe, with the busy practice, reach that RVU goal of 10,000 and be in the higher percentile. But if you're a physician that does not have procedures and you're not putting 10 RVUs in the bucket, 20 RVUs in the bucket, 30 RVUs in the bucket with each procedure you have to do, you really need to sit down with your contract and find out exactly how many new patients you can see. And like I said, the level 4 code is only 2.43. The level 5 code is only 3.17. You're not putting as many RVUs in the bucket as a proceduralist. Let me give you another example. If you're a GI surgeon, an RVU for a colonoscopy is 11 RVUs. Those guys do those colonoscopies in 20 minutes? How many colonoscopies? If they can do 10 colonoscopies a day, they've made 110 RVUs. You add that up. The RVU value for a hip replacement for the orthopedic surgeon is 40 RVUs. So proceduralist, the RVU system works. So if you are a physician that doesn't have high procedural value or RVU value for the things you do, you even have to be more clear on how many RVUs that you make, what the value of that RVU is, because what happens at some places, they just put a number and you don't know. So you have to learn to speak the language of unfortunately, I had to say it, employed physician. So the RVU system works very well for the proceduralist. There are primary care doctors that I know that do very well with the proceduralist or the RVU system, but they're very busy. Hopefully those guys are negotiating a high rate for their RVU. So even if you can only make 5,000 RVUs or 4,000 RVUs, make sure they're paying you $100 for that RVU, not $40 for that RVU or $20 for that RVU. So, when people are evaluating the payment system, you just have to know the payment system. And the reason why I wanted to talk about RVUs is because a lot of people don't know about it until you have to be paid by it. And so I was in that situation while my practice was building, but I had to learn math real quick. So to determine what my paycheck was, I had to, or wanted it to be, I had to know that amount and divide it by my RVU value, and that calculated how many RVUs that I had to do. So, of course, I was a surgeon. I wanted to be busy and do more surgeries and put 10 RVUs in the bucket each time, but not every physician can do that. So you really need to know what currency they're paying you by. If they're paying you by RVUs, if you're a psychiatrist or a family practice doctor, you just need to know that currency and make sure that you're getting paid appropriately for your work. So sometimes you can negotiate a higher RVU value if you're not able to collect as many RVUs. And sometimes that's why, that's why you see a lot of times primary care doctors move around a lot. So in my experience, my colleagues who are in primary care, they do a lot more hospital work because the hospital RVU value is a little bit more extensive. So let me share with you some of those values. The inpatient hospital code is the 99223. When someone's really, really sick, is 3.8 RVUs. The second level, the 99222, is 2.6 RVUs. So that's why internists, they have a busy weekend. They're just seeing lots of patients. They collect those 50 RVUs to put in the bucket and have a good salary. But if you're not that hospital-based physicians where the RVU values are higher, you really need to make sure that when you sign a contract that you make sure that the RVU value, the amount you're supposed to be making is appropriate, but also the bottom line is the value. If you only make or can make 2,000 to 3,000 RVUs, make sure that they're paying you $100 for an RVU. Make sure they're paying you for your worth. That's the bottom line. However, tonight I just wanted to explain to you what an RVU was. Dr. Rashana, Dr. Sherry, every day we just try to educate ourselves about billing and coding, the language, the business of medicine, how to make sure that we get paid appropriately for our work. So yes, we need to master billing and coding, which I will definitely review some of those topics. And if you need some billing and coding coaching, I would definitely like to connect with you. So every week I'm committed here to share my knowledge about billing and coding, because I know as a physician, I went to medical school to help people, but I can't help people if, one, I don't see enough patients or make enough money to join a practice, or make enough money to have enough staff, or make enough money to really thrive in that area. So learning the currency of how we get paid, knowing the language of how we get paid, and make sure that we're being paid appropriately for our work is very, very important. So I want to thank you for joining me tonight. Again, my name is Dr. Charlotte. I'm a board certified ophthalmologist. I'm a billing and coding strategist. I hope that you will connect with me on Facebook, DrCharlottemd. Also on Instagram with the same handle, Dr. Charlotte, CharlotteMD. Also on Twitter and Twitter and Google. But again, I thank you for joining me tonight. Good night from Abilene, Texas. And let's stay connected and be better physicians that know how to bill and code, and just really get paid appropriately for our work, so we will be able to continue to do our work. So if we're taken care of and we're taking care of ourselves, then we will ultimately be able to take very good care of our patients, because I know that's why I went into medicine, and I hope you guys did too. So connect with me again on Facebook, Twitter, or Instagram, and have a blessed night. Good night.